we good to go? Okay, great.
Yeah.
Well, welcome everyone. Good afternoon or good morning, depending on where you are, and I hope you are all doing well today. My name is Katie Naum. I am the Operations Manager for the Northeast Big Data Hub, as well as a project team member for the COVID Information Commons, which is, I imagine, what brought you here today. The COVID Information Commons is an NSF-funded research platform bringing together a community of researchers from all over the map and across just about every scientific discipline that you can think of, all studying and investigating wide-ranging aspects of the current pandemic to better encourage the kinds of knowledge sharing and collaboration that will spark new insights and new partnerships. We've brought together 8 great researchers today from around the country to tell you a little bit more about their current research. This is the first in the monthly series of such webinars, and I hope that you'll stay connected with these, and we'll tell you a little bit more about that as we go on. But before I get too far into that, I'm going to hand things over to the Northeast Big Data Hub's Executive Director, Florence Hudson, who can tell you a little bit more about the COVID Information Commons itself. So Florence.
Thank you so much, Katie, and thank you for setting up these great webinars. We're really excited. So the COVID Information Commons was developed under a grant from NSF, a COVID Rapid Award we received in May at Columbia University, and it was created by the 4 big data hubs from around the country. We have the Northeast Big Data Hub, the Midwest, the South, and the West. And together we cover the entire country. So anyone living in the US is basically within a big data hub region. And the COVID Information Commons is a great opportunity and portal for researchers, students, decision makers, industry, government, nonprofits, everyone to look at the COVID Rapid Awards from NSF. There are approximately 723. And when we did the first launch meeting in July, I believe it was, we asked for a couple of PIs. We begged them, could somebody present, please? And we received 42 requests from the PIs to present, which astounded us. And we were just so delighted. And so what we really try to do in the big data hubs is to follow the community. And since you all wanted to collaborate, we said, welcome to the COVID Information Commons community, not just the Commons. And so Katie's done a great job of setting up these monthly webinars. And you can go to the covidinfocommons.net website. You'll see this on almost all the pages, if not all, on the bottom right. And you can see, you can learn about the COVID Info Commons. There are demo videos and user tutorials. You can look at research funding opportunities, global data sets related to COVID, groups and guides, our events like this one, the project team, and contact information. And as Katie mentioned, this serves as an open resource to explore NSF-funded research addressing the COVID-19 pandemic, so anyone can use this. We're actually looking at a potential student program of how they can leverage this in the future. And when you go here, you'll be able to click through on that blue button for the COVID Research Explorer, machine learning generated map tools, which are very cool. And we hope you're able to use it. And now I'd like to pass it back to Katie, who's going to get us started today. And I really want to thank all the participants and especially all the speakers. Thank you so much for joining us and sharing your inspirational research.
Absolutely. We're so glad to have both our fantastic speakers here today, as well as all of you joining us from around the world. So just a few housekeeping details before we get started. Thanks very much to our students Benji Sango and Helen Yang for helping moderate this event. Given we have a very full lineup, we are going to save Q&A for the end. And we also encourage you to put your questions both in the chat window where the speakers may be able to respond to them directly, and therefore, you increase your likelihood of getting your question answered. Or we also have a webinar discussion channel on our Slack channel that is part of the COVID Information Commons community. You can find the link there on the slide, and Helen is going to drop it in the chat if you're interested in signing up. We also have a mailing list here that you can sign up for to find out more about upcoming events and other items going on in the COVID Information Commons community and how you can get involved. And all of that is at the website that Florence just shared. We'll also be telling you about our speaker lineup for next month at the end of this presentation. And should you have questions about any of this, you can find our contact information here on these slides, which will be made available after the talk for myself and Florence and for the team as a whole. So as I mentioned, we have a full lineup for today. So let's get on with the show. I'll introduce the full roster of speakers here briefly before handing things off to our full speaker. Today we have joining us Erick Jones from the University of Texas at Arlington, Howard Stone of Princeton University, Michael Pazzani and Albert Hsiao of University of California, San Diego, Sirish Nemale of Embry-Riddle Aeronautical University, Dominique Duncan of University of California, Debbie Kim of University of Chicago, Nora Garza and Gabriela Solis-Cavazos of Laredo College, and Ajitesh Srivastava of University of Southern California. We're delighted to have them join us and tell you a bit more about the research that they're doing. And I'm sure you're ready to hear more. So without any further ado, I will kick things off and let Erick Jones of University of Texas get things started.
Thank you, Katie, and thank you, Florence, for having me. Please, when I share full screen, I won't be able to see anything, so let me know if everything is fine so I can start.
Will do. Looks good.
Okay, thank you. Let me start my timer. Well, good morning, everyone. I want to first thank Florence and Katie for putting on this very important research initiative. I also want to thank the National Science Foundation, specifically Georgia Ann Kluge and Faye Cobb Payton for funding this research project and funding it out of two different groups, one for the operations engineering and the other out of smart and connected health. As you'll see, my research is connecting to the health area. This research project, artificial intelligence enabled optimization of the COVID therapeutic supply chain to support community public health, is actually a project that's in partnership with the Houston Health Department, in which we're working with them as we address COVID-19 and also get access to important data sets. So our project is really about looking at how we are actually at-risk communities are going to be impacted through COVID-19, but specifically when therapeutics become available, how the supply chain will actually help facilitate getting those important therapies into these communities. As you've heard on the news recently, the biggest challenge we have is the global supply chain has been disrupted. Without global access to ports, with states actually hoarding resources, it's going to be very difficult for the supply chain to operate as usual. And this specifically impacts us if you look at healthcare supply chain, things such as we saw that masks, gloves, and even hand sanitizer became a big challenge at the first part of the pandemic. And so we can just imagine as we get these important therapies, how different policies are going to drive these supply chains. And so our research has two main components. One is how do we actually optimize the supply chain when it's ever changing, especially, when we say providers, the health supply chain, where are providers? Is it hospitals? Is it community cares? Is it Meals on Wheels? How are we actually going to model this so that we actually can get therapies to everyone, not just the at-risk communities, and also those at-risk communities in the Latino community and the African-American community? We see that those communities are really being impacted from a health standpoint at a much faster rate than other communities. So as we look at this document, you can see that we've used Houston as our test bed, the fourth largest city in the United States, and you can see that we broke it into communities and neighborhoods. Our project has three main thrust areas. One is the automatic data capture and artificial intelligence. I call this physics-based modeling because as we capture data from our smartphones, from our barcodes, this data is very hard to be frank, model because you have to bring it into a flat file into different servers. And it's very hard to capture the data, let alone use it to quantify. We've come up with some artificial deep learning models that allows that data to be quantified. But the things that we look at is when these therapeutics become available, we have to make sure that one, they're not stolen. Number two, the right person takes the medicinals. And so when we look at the supply chain for healthcare providers, it's not as simple as getting it to the right patient. It's making sure the right patient gets it and actually takes the actual therapies, as I've been so informed by the health department. So one, the automatic data capture and artificial intelligence supports those activities. Secondly, we look at thrust two, which is, I call it the main thrust, but again, I'm finding out in healthcare, nothing's ever as it appears. But we have to protect electronic health records. As we get information from these different communities, these are protected data points. And so how we use something like a blockchain or an AI to actually protect that data as we bring it into these important models. And we're also looking at a specific type of supply chain model. Most industrial engineers or optimization people would think about a mixed energy program, but we have to have a customer service component to it that allows for it to actually be, to get to the right place, the right time at the right customer level. We hope that 100% of the therapeutics can get out to everyone, but the reality is there may be some shortcomings in how we use that model to actually determine how that happens. Finally, we look at what are the health cost benefits. Most supply chains are optimized off profit or minimizing costs. Our supply chain is going to be optimized off of saving lives and minimizing the spread of the disease throughout the communities. And so as we get into the modeling and we get into the behavioral costs, it's always important that we're having to I call it flip the script, as I say to my students, and we're going to have to really model off saving human lives. And the societal impact of doing that is a lot more difficult than one would think. So again, I know I have brief time, so I will tell you that we also have an opportunity to capture specific information from these populations. It's not specifically part of our current grant, but we have other grant funding happening. But also as we think about social distancing and how these populations, we call healthy behaviors, how we can model that to actually make sure that those behaviors are founded and that the medicinals are going to be successful as stated. So again, my time has ended. Thank you for making time for us. Thank you, Florence. Thank you, Katie. I think I've stayed on time. If you want to reach out and know more about our project, we'd be more than excited to address it. Right now, the modeling is specifically in the Houston area. There are other cities that are inquiring. So hopefully, if you have any questions or thoughts, please reach out to me. So thank you, Katie, and I'm going to hand the mic back over to you.
Thank you, Eric. Really appreciate that. And you were right on time. So next we have Michael Pazzani and Albert Hsiao of University of California at San Diego, who will be telling us about explainable machine learning for COVID-19 management. So I'll let you guys take it away. Thank you.
Okay, so first I'd like to thank NSF, particularly Information Intelligence Systems, for funding this. And this is a collaboration between myself, a computer scientist, and Albert, a radiologist with a deep background in deep learning. And we're using machine learning methods, particularly deep learning, to analyze CTs or X-rays to manage COVID-19. While a diagnosis is important, we're also concerned with understanding the severity of this disease from the imaging. And finally, it's not sufficient just to say you have a 96% chance of having COVID, or even to highlight a portion of the lower lung, but we aspire to label the images with things like there's ground glass in the lower left lung. We're evaluating a variety of existing approaches for both classification and explanation, and starting to develop new ones as well. The ultimate goal is for machine learning to acquire diagnostic signs that can be communicated to people, such as a clinician when they're doing diagnosis, or perhaps to teach peers or residents without even the aid of a computer marking up the images. On the next slide, we show the process of deep learning. And essentially we have a database, an existing database of images, as well as new images that unfortunately we've collected at UCSD over the past few months of patients with COVID. And the goal is to take images of normal patients, those with COVID-19, those with other conditions, and come up with a learning method that distinguishes them and also provides the explanation. We're quite fortunate in that we get to leverage a lot of existing infrastructure that was already in place of doing imaging, sending it to the cloud for analysis, and then sending it to the clinic, where the physician end user can observe it. All of this was in place already by Albert at UCSD Health, and we've just had to modify the cloud diagnostic procedures with new data from COVID-19. And from here, I'll let Albert take over and explain a little bit more about how we're doing this.
Thanks, Mike. Thank you again for giving us the opportunity to present this work. It's definitely very technical in nature, but also very clinical and impactful immediately, as we're already using it in our clinic. The primary concept is really to develop AI algorithms that allow us to localize pneumonia. This is work that we started even before the COVID-19 pandemic began, but has been accelerated a lot because of the need. One really key important aspect of COVID-19 is that not every patient develops pneumonia. Some patients do and some patients don't. Some become asymptomatic, of course, but those that do, the severity of pneumonia on X-ray or CT provides us very good prognostic information, and a lot of data is starting to come out with that. We've taken a very different strategy towards this UNet type segmentation approach, as opposed to a lot of classification approaches that have been previously used, although both are feasible, and you can generate these kinds of probability maps and whatnot, activation maps from classification approaches, which we'll be exploring as well. The important aspect is quantifying the severity of illness. I guess essentially gives us prognostic information, because ultimately we want to know which patients require hospitalizations, which ones can stay at home, which ones require mechanical ventilation, and which ones are likely to survive or not. And some of our initial data here is showing us that those patients with high likelihood predicted by the algorithm are also the ones that tend to not survive, and are the ones that tend to require intubation. So this will give us really good data for how to best manage these patients. So that's a really critical element of how this will all come into play in our clinic, and hopefully many others through our collaborations. Our current results in COVID-19, this is one example of a patient with COVID-19 who presented to our clinic. Our AI algorithm produced, our initial AI algorithm produced this result, very subtle, doesn't really highlight the areas of pneumonia that well, as it was trained on initially only public data before COVID-19. And we came up with a strategy that uses active learning, transfer learning to specifically identify good cases for us to train on, applying transfer learning to that neural network, using also concurrently performed CTs that were done to give us a better ground truth. And that's given us a higher performance both on the internal and external data set, and really highlights the pneumonia better. So our initial algorithms that were in place we're replacing with these updated algorithms, thanks to the support of the NSF and this project. We've been deploying this in our clinic, and there's certainly articles online about it, as well as a peer-reviewed publication that we brought out at around the time that we were investigating this initially. And our next steps are really to aggregate large data sets across multiple institutions, have multiple readers, annotate, mark up the areas of pneumonia to sort of solidify the ground truth a little bit, use the CT as well, and develop a comparable algorithm for CT in the process. And ultimately, we want this algorithm to be explainable. Is really critical for us to be able to use it clinically, is to be certain that we're relying on features that really matter, not sort of accessory features that the neural network sort of coincidentally saw associated with COVID, but actually things that are related to it. And then assess its clinical utility, both in the detection of disease, distinguishing between other diseases that are quite similar, like pulmonary edema, and then give us best management practices for these patients. So that's kind of where we're going. Thank you.
Thank you so much, Michael and Albert. Really appreciate that. So next up, we have Sirish Namile, who is joining us in place of his colleague, Ashok Srinivasan, who unfortunately lost power due to the hurricane in Florida. So Many thanks, Girish, for joining on such short notice, and look forward to hearing about your work.
Thank you, Katie. This was supposed to be presented by Ashok Srinivasan. He's based in Pensacola, and which is being hammered with hurricane right now. So he asked me to present instead. I'm an aerospace engineering department at Embry-Riddle Aeronautical University. The title of the talk and the title of our project is leveraging new data sources to analyze the risk of COVID-19 in crowded locations. The project brings together two teams. In Vipra team, myself, Ashok, Matthew Scotch, and Anuj Mubai, we were looking at pedestrian dynamics and infection spread models for air travel for past 2-3 years. And CAM2 team with Yungsang Lu, David Barbarash, David Ebert, and George. They were looking at webcam data, publicly available webcam data. So here what we are doing is combining these two data sources, publicly available webcam footage as well as LBS data to analyze pedestrian movement using models of pedestrian movement. And thank NSF for the support. Now, the motivation for the project is as follows. We know that proximity between humans is the main driver for COVID-19, but social distancing, it poses an economic challenge and disrupts many human activities. And some of the activities are unavoidable. For example, air travel, we can reduce it, but complete stoppage of air travel would be economically not feasible. So what we want to do is come up with fine-tuned policies which can be followed in built environments as to how pedestrians can move. For example, layouts. If you talk about air travel, boarding procedures and so forth, that can increase the social distance and decrease infection spread without disrupting the activities completely. Our approach, we use parallel computing to address different situations for a given policy and identify vulnerabilities in the overall system instead of predicting the number of infections. For example, we want to look at how the policy would be effective under different conditions using parallel computing. Now, our basic idea is to use pedestrian dynamics. This here is a simulation of pedestrian dynamics through boarding. For pedestrian dynamics, we use an approach known as social force model. This borrows a lot from molecular dynamics simulations where atoms interact with each other. So in place of atoms, we have pedestrian particles which have balanced forces because pedestrians are moving towards particular target, and repulsion because of interactions. Now, for example, in this simulation of aircraft boarding, we can come up with different patterns of boarding and look at the number of contact minutes. In a recent study, what we found is because of COVID-19, many airlines shifted to back-to-front boarding. But what we find is back-to-front boarding, it increases the number of contact minutes of people within the aisles. So there are alternate boarding approaches, for example, dividing it into multiple zones or random with very slow boarding that would reduce the number of overall number of contact minutes in a boarding simulation. Now, when we're talking about one aircraft, it is easier to do this kind of simulation because the initial conditions are well known. But if you're talking about the entire airplane or a Disney theme park, large spaces, the initial conditions are highly variable, and human behavior is inherently uncertain. So to account for these uncertainty, we want to incorporate new data sources in modeling the initial conditions and modeling the variation of behavior associated with humans in this pedestrian dynamics. The new data sources are location-based services based on cell phone usage data and publicly available webcam footage. The overall idea is somewhat like this. We start with a layout and the procedures, policies. For example, if you're talking about an airport, there are different stages at ticketing, check-in, security gate, and so there are these layouts and procedures associated with that at boarding and so forth. Then we can do pedestrian dynamics at these various instances to we can do pedestrian dynamics to come up with the contacts and further do the infection studies through a SIR infection model. This we augment with location-based services data and network cameras, which can identify things like mask usage and provide information on pedestrian speed and density, so forth. This is the basic idea, and I want to present a very quick example. This is Orlando International Airport. When we use the cell phone data, we can identify locations which have highest pedestrian density that happen to be security checkpoints on either end of the airport. And then we can come up with designs of the security queue that would reduce the number of contacts. We also find that using solid barriers, enforcing single file queue, all of these reduce the overall contacts by up to 75%. I'll stop here. Thank you.
Thank you so much, Sirish. Really appreciate it. And, very relevant for any folks who may be thinking about airline travel in the near future. So next up, we will be hearing from Dominique Duncan at the University of Southern California. And Dominique, we're ready whenever you are.
Thank you. So I'm Dominique Duncan from USC, from the Neuroimaging and Informatics Institute, and I'll be talking about our COVID-19 data archive. For short, it's called COVID-ARC. So we have a lot of experience at our institute with large-scale multimodal data repositories. So we decided to apply our experience and the tools that we've developed in these other projects and extend them to this COVID-19 data archive. So you can see here on the bottom left, that's a screenshot of our homepage. If you want to go to the website, I encourage everyone to go to covidarc.loni.usc.edu to find out more about the project, the various data sets that we have, our analytic tools, and to find out more about either uploading data or downloading existing data that we have. So we have some publicly available data sets that we've been curating and organizing. We want to encourage researchers to be able to not only perform analysis on individual data sets, but across data sets from various sites. And so we want to make that process easier for them. And so we're also providing various tools like quality control tools that people can use to evaluate images and evaluate the quality using various metrics. We have various visualization tools for imaging data and other types of data, and then a wide variety of analytic tools that people can use. And then for data sets that are not publicly available, data providers can decide if they want to store their data on our server or if they want to keep their data stored locally at their site and just provide us with the metadata so that we can let users know what data are available, and then we just facilitate the process of requesting access to that data. So if data providers give us their data, it's anonymized, and the data providers maintain full control of access, and they get to decide who gets access to it, if they want to wait to publish some findings and then make their data sets publicly available, they're able to do that as well. And then we use Aspera, which is IBM's HIPAA compliant encrypted high-speed file transfer system for either uploading data to our server, or for people who want access to the data, they can download it that way as well. And I know you can't see any of this text, but this just gives you an overview of what we have on our server. So if you request access, this is the tree structure of the COVID ARC project. And so it's separated into the data and then our analysis that we've been working on, because we're also very involved in the analytics for this project. So the data will be separated by the different sites, and then there's more information on each of those. So here is a table of the data sets that we currently have on the server. So you can see the location where the data were acquired for each of those data sets, and then the data format of those images. Right now we're focusing mainly on chest CT, but we're also interested in other types of data. And soon we'll have some brain data, so brain MRI of COVID-19 patients, as well as EEG. So here you can just see how many COVID images and non-COVID images and masks are there from each of those sites. Here you can see some class activation maps. So there are many features, as we know, CT features of COVID-19 patients, like ground glass opacity, consolidation, crazy paving pattern, reticular pattern, etc. So this just highlights the regions that were most important for our classification that we're doing. One of the issues that we're discovering is that image quality tends to lead to misclassification. And so we're assessing the quality of the images, but then also considering various ways of improving the quality of the images. So looking at different filtering methods, and that's something that's currently in progress. We're also doing image thresholding on the lung masks. So we're using image thresholding to find the best possible processed image type in the lung masks to improve the prediction rate of our neural networks. And this is a table just on one of the data sets, that first one from Brazil that had about 1,200 COVID patients and 1,200 non-COVID images. And we did a comparison looking at various methods to compare convolutional neural networks and their accuracy. So we found that ResNet 18 performed the best for that. And just to summarize, because I think I'm at the end of the time, these are the people that are working on the project, including the REU students. And I'd like to thank the NSF for funding this project, as well as Katie and Florence for organizing this and inviting me to talk. And please visit the website or email me if you have any questions, and if you would like access to any of the data, or if you have some data that you would like to contribute to the website. Thanks.
Thanks so much, Dominique. Really exciting to hear about all of these efforts for collaboration. Next up, we have Debbie Kim from the University of Chicago. Debbie, we're ready whenever you are.
Sure, let me see if I can share my screen. All right. Is that showing up the way it's supposed to?
Yes, we see it, and you can click the bottom to go into screen share. Perfect.
Perfect. All right, great. Hi, I'm Debbie Kim. I am a senior researcher at NORC at the University of Chicago in the K-12 Education and Child Development Group. And I'll talk quickly about our ongoing project called Measuring Pandemic Learning Loss, Implications for the Future STEM Workforce. So as we all know, in March 2020, schools across America shut their doors and very quickly pivoted to remote learning or distance learning for their students. And it was pretty varied in the way that happened in lots of different ways, levels of instruction and access across the country. Lots of factors shaped that. And there's a lot of talk now about, we know that there was no lack of existing inequalities in the education system prior to COVID. And we know that this time will very likely exacerbate what was there and create new ones. And in this project specifically, we're interested not in just measuring on a national scale, what we're calling the pandemic learning loss that's occurring during this time. But for high school students to also understand why it's happening so that perhaps in the future we can inform policy and practice in ways that can help mitigate its impact. And we're focused on the high school population, and we're looking specifically at STEM subjects. So we're doing that using two sources of data. The first is Infinite Campus. Infinite Campus is one of the largest student information systems in the country, and they have data on about 2.5 million high school students across 2,000 districts nationwide. And schools and districts use this SIS for all kinds of different things. So we have data on information ranging from course enrollment and achievement in those courses, attendance, discipline, household characteristics like income and number of siblings in the family, urbanicity, all the way down to where they sit and where their lockers are. So using this data, we'll be mapping high school students' STEM trajectories pre-COVID. So what kinds of courses were they taking? How are they doing in that? What kinds of students were engaging in what kind of STEM learning? And then we also have information on what was happening during COVID. So how often and for how long they were logging into the remote instruction, if there was assessments, how they were scoring on those. And we'll know when they come back to school, when we return to some version of something, what they'll look like, what their STEM trajectories will look like at that point. And we'll know that there's going to be a disruption in the during period. And this will really help us hopefully understand what caused time A to look so different from time B and for what kind of student. That is a massive data pool. We're working with them now to get all of that into the right shape for us to analyze. And we are also we have an AmeriSpeak team panel, and we surveyed about 2,000 high school students in late spring 2020. So asking them in real time during the quarantine, how are you spending your days? What kind of formal and informal STEM learning are you participating in? What are the barriers or facilitators of this learning? And even some questions about if the pandemic has changed their perception of the importance of STEM and if that might have shaped their career trajectories. So we just got that AmeriSpeak team panel data back last week, and we're cleaning it and weighting it and all of that. So I have some preliminary findings, and we're really looking forward to having them more concrete in the near future. About a quarter of high school students in late spring 2020 said they did not feel academically prepared to return to school in the fall. And they also reported that they spent about 3 hours a day working on math and science. And we also asked them open-ended questions about how they facilitators and barriers for remote learning. And we're coding that data now. And we're seeing a pretty big range of what they're talking about. Things ranging from home environment and learning structure, so these distractions in the household, access, which I think is what we've heard about the most in public discourse around remote learning. So having spotty internet or siblings who are battling for that laptop or the phone or the tablet. This is, I think, the most interesting to me, the social dimensions of learning. So really missing having that physical and emotional interaction with people in person that I think no matter how good remote instruction is, it's really hard to duplicate that. And also just a lack of support, no supports or input from their teachers. We also heard a bit about what is good about remote learning. And it's interesting that these seem to be more about, personal preference or things that might be a little more specific to the student. So liking that they have control over their own schedule, they can learn on their own time. One person talked about how with their learning disability, the text-to-speech options makes it easier for them. Or, they get migraines and they're able now to control how long they're in front of a screen or when. So we're hoping that we can learn both from hearing about what's positive and negative and having this broader landscape of what happened for high school students overall to mitigate a bit of that gap that's going to happen as students come back. Do some thinking about how to support what kinds of students and what kinds of ways to keep trying to diversify that STEM workforce in America. So, thank you so much.
Thank you very much, Debbie. I think this is a lot of stuff that's on all of our minds as so many go back to school in whatever environment. And continuing thoughts on education, we have up next Nora Garza and Gabriela Solis-Cavazos of Laredo College. So I'll let you guys take it away.
Thank you very much. And thank you all for hosting us with the COVID Information Commons. It's nice to be able to share. I'd also like to thank Laredo College and my RAPID team of faculty members that are part of this group, and the RAPID research assistant students that are coming on board as we speak. Gabriela Solis-Cavazos is the co-PI for this grant. Also thank NSF and the HSI program, which is funding this RAPID grant. Gabriela Solis is our undergraduate research coordinator for a grant that we have where students are already participating in undergraduate research experiences with faculty partners. So Gabby, for the next slide. We have a challenge, as everyone does, with extra stress on all our undergraduate students. We are a primarily Hispanic on the Texas-Mexico border community college, two-year college, now called Laredo College. We have had, like everyone else with the coronavirus, interruptions in undergraduate research opportunities. For example, our faculty members would work with our students in labs or outdoors. For example, doing bird counts in our environmental science center, even working with virtual mannequins and things. I mean, the real mannequins now are real, and now they have to have virtual working with these. So in order to keep our students engaged, I think some of you that do work in education are noticing, are seeing our students feeling completely overwhelmed. Some of the things that Debbie Kim mentioned, exactly the same thing. Lack of resources, the digital divide. Not all our students have the best technology, the best internet connections. So this sense of not hopelessness, but definitely a panic of these are very good students who want to stay connected, want to stay engaged, and want to be successful. And those are our goals exactly. So Gabby will give you a little bit more about our solution and what we're doing about it.
So
Gabby?
when the impossible happens, think of the possible. And with that, our solution was to engage the students in the current pandemic. We want them to generate knowledge and learn about COVID-19 while gathering real-time data. With that, we have 20 RAPID students and 6 faculty members. Okay, we have 3 objectives that we are trying to meet. Our first objective is to implement a data analysis research experience. The second objective is to create a professional development course for the faculty. And the third objective is to evaluate the project's impact on students' quantitative reasoning skills, their attitudes towards quantitative information, and their subsequent STEM coursework and college success. So we will be creating faculty development training for the 6 faculty mentors. They're going to be assigned reading assignments like the Math for Life. They will be assigned calculation assignments, some discussions, all of which will be done through Zoom. So we want to know some problems that students face and that we can try and correct. So both of these images here, they show our faculty working on research projects with our students. In the top right, we have our students learning about water quality with the Rio Grande. And in the bottom, we have Dr. Meng teaching the students about chemical compounds. With our RAPID Research Assistant, these are the 20 students that will be working with us. They are going to learn how to collect data online from COVID-19. So right here, we have an image of the Laredo COVID dashboard, which is updated daily on COVID cases. And we want them to learn how to analyze it and understand what they're seeing. As well, that each of them received a thermometer. So they will be recording their temperatures. And we want them to report their temperatures to the Kinsa Health Weather app, which is an application where they're trying to provide information to the public about safety, about diseases, knowing like if there is a group of high temperature, maybe there's something going on in that area. Overall, we want the students to create a poster and present their research findings to spread their knowledge to others.
We are also coordinating with Dr. Esther Wilder at Lehman College. So this is as much a capacity building project for Laredo College and for our colleagues and for our students to stay resilient and stay engaged, be retained, be successful STEM majors. If you have any questions, we know we have many questions for you. Some of our students are listening, some of our faculty are listening. But if you have any questions beyond this time frame, you can contact us at that email address. Thank you.
Thank you both so much. Really exciting to see collaborative activities like this get up and off the ground. And that brings us to our final speaker, Ajitesh Srivastava of the University of California. And Ajitesh, you can share whenever you're ready.
All right, thank you. I hope you can see my screen.
Yes.
Okay, so my name is Ajitesh Srivastava. I'm the co-PI of this rapid award called Recover Accurate Fine-Grained Predictions and Resource Allocation for COVID-19 Epidemic Response. The goals of this project are the following. Accurate COVID-19 forecasts at various levels, including for various countries, for state level, county level, and also fine-grained forecasts like neighborhood level. We'd like to incorporate data-driven identification of number of unreported cases, which are not really observed, but they significantly affect long-term forecasts. And finally, how to utilize these forecasts effectively for resource management during the pandemic. This is what we have achieved so far. We have an accurate COVID-19 forecasts. In few seconds, we can perform training and forecasting for 3,000 counties in under 30 seconds. We provide reliability guarantees on unobserved factors. For example, how much underreporting is going on. In some cases, we can identify that number and we can mathematically guarantee that that number is close to the truth. We have a publicly available web interface and GitHub repo, and we also provide weekly evaluation comparing our approach against models currently being used by the CDC. We are providing our case and death forecasts, which includes weekly US national levels, state level, and county level. These are to be used to inform the public and to be used for vaccination trial site selections. We're also providing our forecasts to develop ensemble models to UMass Forecasting Hub and also KIT, where we are providing Germany national and state level forecasts. Here are the publications. 2 of them are preprints and 1 of them has been accepted at the KDD conference. So the central idea that we claim here is that a model is not enough. Just having a new model that is complex is not enough. Forecasting requires making decisions regarding, what learning strategy you use, what kind of data preprocessing you use, what do you choose as parameters, what you decide to have as hyperparameters. All these decisions can significantly affect your forecast outcomes. With that in mind, we would like to have a model that captures various complexities, and yet we prefer simple learning approaches to avoid overfitting so that we know what we are learning is actually close to the truth. And to that end, we want to mathematically check learnability, whether what we are claiming we have, did that just fit the past data or did it actually learn something? And we would like to have fast execution to enable scenario analysis. And you can read this paper to understand how we start from a complex model and simplify it into a mathematically equivalent model, which is easy to learn. So one central aspect of our work is to address learnability. Despite simplifications, one equation in our model is still nonlinear. So we can always, fit your data to any model, but does it reflect the truth? Because there may be multiple solutions. For example, here for underreporting factor, you see 4 curves. All these 4 models, in a way, they fit the past data very well, but they lead to significantly different outcomes. So how do you know which of these 4 curves reflects the truth? So we proved that this underreporting factor can be learned reliably from data only under certain conditions, and the details of this are in the paper. We have an online visualization where you can interactively perform forecasts, and you can also look at various scenarios of where we are going and what would happen if we put our best effort versus what would happen if we put our worst effort, and where we might be in a few weeks from now. On our page, we also provide comparison of our approach against other approaches being used by the CDC, and we've been consistently in the top 2, top 3 among about 25 models that are being used currently. Other relevant work we're considering is reliably learning the effect of various policies. We're also interested in solving some resource allocation problems now that we have accurate forecasts. So how do we allocate PPEs, or how do we decide where the testing should happen across the map and where you should have vaccination sites? And with that, I'll end my talk. Thank you.
Thank you so much, Ajitesh. Really impressive performance. And thank you to all of our fantastic speakers who have spoken today. I know I want to be mindful of the time, but I see that there have been a few questions which have already been answered in the chat. But I think there might be a couple outstanding. Helen, can you share any questions that we may have received during the presentations?
Sure, yes, thank you. First of all, thank you to all of the researchers again who have both presented their projects as well as who've been keeping up in the chat. So I see one outstanding question, and I guess this is for all of the researchers. So this is from Yang Xiang Lu, and I apologize if I'm pronouncing your name incorrectly, but the question is anyone working on detecting face masks in public locations? If you're creating technologies detecting masks, or you are interested in using the technologies, or if you have data and want to try, please drop me a message, and he's provided his email. So would any researchers like to respond to that question?
Or anyone else on the call? I know we have other researchers as well. If there isn't anyone who is working on this call, I would encourage you to post about it on the COVID Information Commons Slack. I think Helen can drop the link in the chat if you didn't see it earlier. There may be people in that community who are working on this issue or know of someone who is. I would say that following up with them would be a great idea. And you can certainly also, reach out to our project team as well if you have any questions about connecting with people in certain areas, whether this or other topics that you're interested in. Thank you for the question.
And I guess even though we're at the top of the hour, I guess just a couple things. First, this is Florence. I really want to thank Katie for putting this all together. And we hope that you join our follow-on. Maybe you could show the chart for the October 16th webinar. And I really want to thank Helen and Benji, who are juniors at Columbia University. And they are just a wonderful part of our team. And we're so grateful to have them, and all the presenters and participants. When I was listening to some of the researchers, I was thinking, ooh, if you and you got together, you might be able to figure some new stuff out. So are there any collaboration opportunities like that any of you want to reach out? I know I already connected with Dominique. I want to chat with her a little bit when she was talking about people having their data sets and potentially, doing compute where they are or elsewhere. We're thinking of what the future of the COVID Information Commons can be, and I'm trying to understand more of what's needed and what would be valuable. And so I think she has some ideas on that, but I'd be interested in that, or other cross-collaborative ideas. Any comments you all want to make with each other? Nora?
Well, the most important thing is that your site and the ability to come together is marvelous. And so our students and our faculty and others across, if not immediately, will soon in the next few weeks begin to find these collaborative opportunities. So I thank you especially for having, thinking about this and then bringing us together, not just us, but all the others that are going to be, and that people will be able to use your site as a proper, safe, true information source. Thank you.
Thank you, Nora. That warms my heart. That was our goal. I can't believe it worked. But we want to keep going. So thank you.
I just wanted to add thank you for bringing us together. Michael and I have a Zoom set up for Friday, so hopefully we'll find a way to collaborate too.
Wonderful.
Fantastic. I'm so glad to hear
Yes, we're
that.
looking forward.
This is absolutely the kind of collaboration that we're hoping for out of this. If nobody else had a question, I'm aware I may have spoken over someone. I just want to run over a few last details before we let you break off. All right, so again, the recording of this presentation will be made available at covidinfocommons.net. And our next event will be held on Friday, October 16th from 12 to 1 p.m. ET. You can find the registration link here as well as on our website, covidinfocommons.net. We have a really great lineup, and I see some of our speakers from our next event who are on the call today. So you can look forward to hearing from all of these great folks in October, and there will be future monthly events going forward from here. So I would encourage you all to stay connected. Please feel free to make use of the Slack or, get in touch with each other directly as well as with our team. And thank you once again to our fantastic speakers, to our great project team, including Florence, all 4 of the big data hubs, and our amazing students here at Columbia, and to the NSF as well for making all of this possible. And thank you so much. I hope you enjoy the rest of your day.
Yes. Join us again, and everyone be safe.
Take care.
Thank you.
Thank you. Thank you. Thank you.